Most men think fixing erectile dysfunction is as simple as taking a pill, the famous quick solution that everyone has heard about. But here's the surprising truth. For many men, the real and lasting solution doesn't start at the pharmacy, it starts with lifestyle. Urologists agree that before considering surgery, injections, or even daily medication, the very first line of defense against ED is how you live your life. The food you eat, the exercise you get, the amount of sleep you allow yourself, how you handle stress, and even habits like smoking or drinking. All of these factors play a major role in whether your body can achieve and sustain an erection. In this video, we're going to break down the specific lifestyle changes that urologists recommend for their patients. You'll see how simple, everyday choices can improve blood flow, balance hormones, protect your heart, and ultimately restore not only your sexual performance, but also your overall health and confidence. When it comes to erectile dysfunction, most men focus only on the symptom, the difficulty getting or maintaining an erection. But a urologist looks deeper because ED is often the body's first warning sign that something else is going on. One of the biggest underlying causes is cardiovascular health. The arteries in the penis are smaller than those in the heart. That means if blood isn't flowing properly, erection problems usually show up before chest pain or heart disease does. In other words, ED can be an early alarm bell for heart trouble. Another common link is diabetes and obesity. High blood sugar damages nerves and blood vessels, while excess weight lowers testosterone. Together, they create the perfect storm for erectile problems. Lifestyle choices like poor diet, lack of exercise, smoking, and heavy drinking make these conditions worse. On the flip side, healthy living strengthens circulation, balances hormones, boosts energy, and protects the prostate, all of which directly improve erectile health. That's why urologists always say, healthy choices mean healthier erections. Addressing lifestyle isn't just about performance. It's about preventing heart disease, diabetes, and even prostate issues that could shorten your life. One of the most powerful lifestyle changes a urologist will recommend for erectile dysfunction is improving your diet. What you put on your plate directly affects your blood vessels, your hormones, and your ability to perform. A diet rich in fruits, vegetables, whole grains, nuts, and healthy fats like olive oil and avocados helps keep your arteries flexible and your blood flowing. Fatty fish such as salmon, sardines, or mackerel provide omega-3s that protect the heart and improve circulation, which is vital for strong erections. On the other hand, diets heavy in processed foods, sugar, and saturated fats can clog arteries, raise cholesterol, and lead to obesity and diabetes. All of these conditions are strongly linked to ED. That's why many urologists recommend following a Mediterranean-style diet, which has been proven to lower the risk of heart disease and improve sexual function. Staying hydrated is just as important. Drinking enough water supports circulation and energy, while reducing alcohol intake prevents hormone disruption and nerve damage. The benefits of healthy eating go far beyond the bedroom. Better blood pressure, balanced blood sugar, improved weight, and more stable energy throughout the day. In short, the foods that keep your heart strong are the same foods that keep your erection strong. Changing your diet isn't a sacrifice. It's an investment in both your performance and your long-term health. Along with diet, exercise is one of the most effective lifestyle changes for improving erectile dysfunction. Why? Because erections depend on healthy blood flow, and nothing boosts circulation better than regular physical activity. Cardio exercises like brisk walking, jogging, cycling, or swimming strengthen the heart, keep arteries open, and ensure that blood can flow easily to the penis. Just 30 minutes of moderate cardio most days of the week can make a noticeable difference. Strength training also plays a role. Building muscle with weights or resistance exercises helps the body use insulin more effectively, reduces fat, and naturally boosts testosterone, one of the key hormones for sexual desire and performance. Another overlooked but powerful exercise is pelvic floor training, or Kegel exercises. These strengthen the muscles at the base of the pelvis, which support erections and help with ejaculation control. Many men notice improved firmness and stamina after just a few weeks of consistent practice. The best part? Exercise doesn't just improve erections, It also lowers stress, improves sleep, and boosts confidence, all of which support sexual health. As urologists often say, what's good for your heart is good for your erections. Regular physical activity is not only medicine for ED, it's prevention for heart disease, diabetes, and prostate problems too. When most men think about erectile dysfunction, they focus on the physical side blood flow, hormones, or the prostate. But your mind and lifestyle habits play just as important a role. Let's start with sleep. Getting 7 to 8 hours of quality sleep each night keeps testosterone levels stable, supports blood vessel health, and recharges your nervous system. Men who regularly sleep less than 5 to 6 hours often see a drop in testosterone and more frequent erection problems. Next is stress. Chronic stress floods your body with cortisol and adrenaline, two hormones that restrict blood flow and shut down sexual desire. Add performance anxiety into the mix, and even healthy men can experience ED. That's why learning stress management is so important. Techniques like deep breathing, meditation, yoga, or even a simple walk outdoors can calm the nervous system and restore balance. Mental health also matters. Depression, anxiety, and relationship tension can directly interfere with sexual function. In these cases, urologists may recommend counseling, sex therapy, or working with a mental health professional. These approaches not only reduce ED, but also improve confidence and intimacy. The bottom line is this: your brain and body are deeply connected. Prioritizing sleep, managing stress, and caring for your mental health can be just as powerful for ED as any pill. And often, it's the missing piece many men overlook. One of the most important lifestyle changes urologists recommend for men with erectile dysfunction is to quit smoking and limit alcohol. Let's start with smoking. Cigarettes damage the lining of blood vessels and cause arteries to narrow. Since erections depend entirely on good blood flow, smoking is one of the fastest ways to weaken sexual performance. Studies show that men who smoke are far more likely to experience ED, often years earlier than non-smokers. The good news? When you quit, circulation improves quickly, and many men notice stronger erections within months. Now let's talk about alcohol. A small amount, like a glass of wine, might help with relaxation, but heavy or frequent drinking does the opposite. It lowers testosterone, damages nerves, and dulls the body's sexual response. Long-term alcohol use can even lead to permanent ED. By cutting back to moderate levels or eliminating alcohol altogether, you give your body and hormones the chance to recover. As urologists remind their patients, the less you smoke and drink, the stronger your performance will be. Quitting these habits isn't just about protecting erections, it's about protecting your heart, your liver, and your long-term health.